almost they were treated like demigods. Of course, gradually the aura of infallibility of doctors dimmed, and the paternalistic relationship, which is good, no doubt, but with changing times, with the high tech medicine, and of course, with the societal changes, the paternalistic relationship got changed, replaced with what is called patient autonomy.
Okay.
So what is the meaning of patient autonomy? It means that the patient need not blindly trust his doctor, and the patient is the owner of his body, and his decisions should be honored. That he should take informed decisions. Now, obviously, when that happens, the doctor would want to explain everything to the patient. I'll talk at length on this when we talk about the informed consent.
Correct.
And after that, the patient himself, after gathering all the information, takes a decision.
Mhm.
So that is patient autonomy.
Okay.
It means he's independent.
He can decide for himself.
He doesn't have to blindly, and which is a good thing. Which is a good thing also. It's not bad. But in India today, because patients are not that well informed about medical matters, so they obviously would still, a lot of doctors still, the paternalistic relationship is still existing in our country, because they do trust the doctor, and often they say, डॉक्टर साहब आपको मालूम है ऑपरेशन का जरूरत है, आपने बोल दिया तो
हो गया, करना है.
सही है, आप गलत थोड़ी बोलोगे आप.
Correct, correct.
You know, so today that is the kind of thing. But of course, by and large, patient autonomy has taken over the paternalistic relationship. A doctor-patient relationship is legally called a fiduciary relationship. Now, what is the meaning of fiduciary?
Common language.
Pardon?
In common man's language.
Common man. It means fiduciary relationship means based on trust.
Okay.
It is based on trust.
Trust.
But it's very important that this trust must be mutual. And that is where we need to repair this doctor-patient relationship, which has eroded over a period of time. And of course, societal changes, materialism. Today, why doctor? Every section of society has changed.
Teachers are complaining. Everybody is.
And if they say now doctors are not what they used to be, so what do the doctors say? The patients are not what they used to be.
It may not be, because once when doctor from noble profession, when it becomes a profession or when it becomes a business, obviously the whole approach would change.
Yes. Now talking about business. Now why has this happened? Because the medical profession under the Consumer Protection Act 1985 was brought under the jurisdiction of this act.
Okay.
Which means a doctor giving service to a patient was given for consideration after charging, and therefore it would come under the Consumer Protection Act, which to my mind is something which is very unfortunate.
Yeah.
To compare a
shopkeeper
profession dealing with life and death, that profession to be compared with commercial business is, I think, has, in my opinion, it has harmed patients more than it has helped them.
Yeah, it has harmed. I mean, today the relationship is absolutely at worst.
So there is a distrust, and of course, not to say that there aren't patients who still do trust their doctors.
Plus or minus is going to be there.
And But overall, there is a metamorphosis, there is a change in the
There is a
doctor-patient
trust
relationship.
deficit
Yes.
anyway.
Yes.
What about the patients? When we talk about patients, what are my rights as a patient?
Yes, certainly, uh, patients do have rights, and not only morally, also legally, they have rights. In fact, these rights are statutorily supposed to be displayed. It is called the Charter of Patient Rights,
Okay.
and a lot of legislative intent is there where hospitals are required to display this Charter of Patient Rights, and which again is something which sensitizes the patient to his rights. The rights, of course, if I were to mention, what are the rights of patients?
A couple of very important rights.
Yes. See, first thing is that the patient has a right to be treated with courtesy by the doctor.
Right.
Secondly, after having been examined and investigated, the patient has a right to know what is wrong with him, what is his diagnosis, why certain investigations have to be done, what is the treatment for that, what are the side effects of the treatments. So patient ought to know, in other words,
Everything about
what is wrong with him, how it is going to be treated, what are the effects, bad effects,
that.
what are the chances of success or failure. So this, it is the right of the patient to know what is his diagnosis, what is wrong with him. Now, of course, having told those, given that information to the patient, because of patient autonomy, now it is the patient who has to decide whether he would like to follow the advice of the doctor or not follow. So that is the right to know information. He has a right to get his records.
Okay.
Get
So doctor can't say, "Ki, I will not give you my record."
No, doctor should not and cannot say that I can't give you. The patient has a right to have his
Access to
records,
it.
access to his records. Patient has a right for a second opinion. He can definitely say that doctor, I'd like to consult, even if he doesn't tell the doctor, it doesn't matter, but he has a right to consult somebody else to confirm. Patient has a right to know the cost of treatment, as to what the treatment will cost, and he has a right to have transparency in the charges, to know what is the bill for what he has been charged, and preferably in advance. So these are some of the important rights of patients. Of course, he also has the right to the give his. He has a right to refuse treatment.
Okay.
Suppose the doctor says you need a surgery or you need so and so, he has a right. He can say sorry, or rather, I'd rather not get operated. It is his right. So these are some of the basic rights.
I have heard a case where OPD cardiologist, he advised the patient that you get admitted. It's a semi-emergency. The patient said, "No, I'll go back to my home. I'll discuss and come back." And so doctor said, "Give me a consent for refusal of
Correct.
further this thing." So he said, "I won't sign." And he went away. He died on road. And the relatives sued the doctor, saying that this is a medical negligence.
Correct. Yes, that can happen. And now, therefore, you can understand why a doctor wants you to sign a consent, that means approval or denial of consent. Even like in this case, he said, "No, I don't want to get admitted." Now, the doctor asked him to write down to say, I have been advised the admission to hospital, but I do not wish to get admitted, and I have been explained the risks and consequences of the same. He should sign.
Yeah, but
Now he refused to sign.
correct.
He refused to sign.
So I don't want to.
So doctors, many doctors ask me, what do we do in such a case? He is refusing to sign. So my solution is that even if he refuses to sign, surely you get some witnesses, some other patient, some patient's relative, your staff member, and let them endorse. Say that yes, in front of me, doctor has said, your nurse may be there to get admitted.
Correct.
Preferably, it may not be somebody from your staff, because that could be
A partial
afterthought.
Yeah,
You know, preferably somebody neutral.
waiting room or outside.
And he said that yes, doctor told him, and he refused to sign also.
Mhm.
So that's one way for the doctor to protect himself.
Okay. When we are talking about the consent forms, invariably hospitals take consent form very casually.
Very-
They just give a piece of paper to the patient, sign, either sign karo, either sign karo, either sign karo. Now, many of them don't know also where to sign, what to sign, who can sign, whether my wife can sign on my behalf, whether and if I'm all right. I mean, what's the discipline for? Because consent forms probably are 50% of medical legal cases. If I say so. See, there are two. Major is negligence. The patient feels that I have been neglected. I was lying in the hospital bed. No doctor came, nobody came, nothing happened. So that's a negligence. And the second one is even the nurse who is not serious about getting the consent form signed. What would be your advice to medical professionals also?
You see, now the time has gone when one could be casual about consent, and most doctors, hospitals, of course, some of them still don't realize the importance. Most of them realize the importance of why so much stress is laid on consent.
Mhm.
Now, this is where comes the question of the patient autonomy.
Correct.
It means, and sometimes patients also object. Patients also feel, अरे you are doing one small surgery, you are taking इतना लिख के ले रहे हैं legal document के जैसा. Patients also must understand it is also in their interest that consent form, of course, the quality of the consent form should be good. It should be in simple language which the patient can understand, and the consent should explain what is the problem with the patient, what is the diagnosis, what is the patient suffering from, what is the treatment that has been advised, what are the risks and advantages and disadvantages of that surgery,
procedure.
what will happen if you don't follow this advice. It says that if you don't, suppose somebody's got an appendix and he is advised operation, and he says, doctor, suppose I don't get operated, then you should know. If you don't get operated, infection will spread in your abdomen, become very serious, and you could go into septicemia and so on. So all this is called informed consent, which defines the risks, consequences, benefits, even explains the little bit of a procedure, and ideally, and this is what we always advise doctors to take a procedure or an operation specific consent.
Okay.
Which means, suppose somebody is getting operation for a gallbladder surgery, then the consent should say, in gallbladder surgery, what can happen?
Correct.
And it should not be a blanket consent for any one consent for every operation. And so, which I would also advise that patients should not, as you said, just sign casually. They should try and understand. They should read it and not just sign. Now, any property document, will you sign just like that without reading? You won't do it. So, of course, this is not a property document, but you should know. In fact, you should ask questions to your doctor. Just don't sign the consent. You ask the doctor the questions, and he is bound to answer you as to what exactly, because if you don't understand.
Now you are a founder member of Association of Medical Consultants, AMC. I mean, you hold a very senior post there. Now, typically, what happens is, besides the consumer court or something, is there any redressal, grievance redressal mechanism that is available for before the problem becomes too big?
See, the patient who feels that he is a victim of negligence in a hospital or by a doctor, definitely he has several avenues of redressal of the grievance.
What are the, I mean, at least
Yes.
few of them?
Now he can go to file a complaint before the consumer court in order to get compensation for the damage that is caused. But of course, he has to establish, he has to prove that the doctor was indeed negligent, and because of that negligence, some damage was caused, and that the court would decide. See, so he can do that. He can complain to the medical council saying that
These
this.
are, I think, extreme cases. I'm talking about trivial issues which people are saying. 90% of the issues are trivial issues that probably the doctor or the nurse didn't hear me. So I feel if you lend an ear for listening, majority of the complaints will never happen.
Yeah, that
What's
is
your
that is
opinion
true.
on it?
That is true. If these complaints are brought to the notice of the right authorities, they ought to be properly examined. And it is true that a lot of these would not get aggravated or escalated if they are heard with empathy, or if the patient has some misperception or some misconception, he is kind of explained the whole thing, because often lay persons might not understand technical matters. So yes, a lot of these can be avoided.
Suppose today people are using social platform as a billboard for that purpose.
Yes, yes, but that is so with every profession.
Yeah, every profession.
And that is something, there are good things in social media, there are bad things. And so that, of course, there are laws for it, cyber laws. If you cross some limit, it amounts to cyber crime and so on. But that is part of progress which we are making, and we have to accept the good and the bad.
One more thing I wanted to know from you, not the patient, and I'm talking medical. Now, suppose there is an accident, road accident, and there is an ophthalmic hospital close by. If a patient is taken there, can the doctor refuse the treatment?
See, if there is let's not talk about ophthalmic, let's talk of anywhere,
they can, which is
even
not
a doctor, even anywhere. Now, a doctor, legally, morally, ethically, should not and is not supposed to refuse treatment. Now, treatment doesn't mean that suppose I'm a eye surgeon, I can't treat something, chest injury or something like that. I'm not trained for that. But the definitely the doctor should quickly try to judge the situation, give first aid if required. First aid anybody can give, even you need not be a doctor. Even forget doctor, as a human being.
Okay.
You should, somebody has come injured, you can't say, suppose he's got a fracture, somebody, even a doctor who is not trained in it, he knows the first aid at least. Suppose he thinks that there's a fracture, can you not put a splint, put a cardboard or something over bandage, so that will help while shifting. Achha, there is somebody bleeding somewhere, can't you just put a pressure dressing? This anybody can do. So no doctor, there's a famous judgment called the Permanent Katara judgment of the Supreme Court. It has said no doctor should straight away refuse an emergency, not necessary to treat it. If he is not capable of treating, on the contrary, he's doing more harm, he's wasting time.
Correct.
Better he should make arrangement, help you as a human being to see that you are shifted to another place. So he's not bound to treat you, because that itself could be negligence, that you are not qualified how you are treating.
Now, as you said, that patient can refuse to take a treatment. Can doctor refuse to treat a patient? Suppose there is a history of being aggressive, being non-adherence to the advice, and so on and so forth.
Certainly.
Now, can doctor refuse? Sorry, Mr. Gentleman, I cannot.
Yes, doctor can document it. He must document. Patient is not cooperative. He doesn't come. He doesn't take medicines. He doesn't carry out orders, and therefore.
And still expect me to get cured.
No. So I would not like to treat the patient. That is perfectly, reasonable.
Okay, so doctor can take a note of it and
yes, that anybody would understand that you are not following my instructions, then what's the use of I treating you? Because tomorrow you will blame me or you will say that I was negligent.
Correct. Anything from your side that we have missed in this discussion?
Now, I think what we have missed a very important thing, and that is doctors have got rights and patients have got rights. The other side of the coin of rights is responsibility.
Correct.
Doctors, the patients also have responsibility. You can't say I've got only rights.
Okay, it's a combined combo.
It's the other side of the coin is responsibility. So patients have some responsibilities, and the key responsibilities I will mention. One is to be truthful to the doctor.
Yeah, that's
when he asks for your history, the first thing the doctor does is to ask you a history. आपको क्या तकलीफ है, कितने दिन से है, now your current history. You should be truthful. I have got fever since 20 days and I am saying 2 दिन से बुखार है. You are misguiding the doctor. You are harming yourself. So you should be truthful. Not only in the current complaints, in your past history. Doctor says, do you have diabetes? Do you have blood pressure? कभी टीबी का बीमारी हुआ था क्या? Now people they want to hide. नहीं, किसको नहीं हुआ? घर में किसको हुआ था? किसको नहीं? हमारा 7 जनरेशन में किसको नहीं हुआ टीबी? You are misguiding. Epileptic fit हुआ था कभी? You hide. Never hide or tell the falsehood to a doctor. You are harming yourself. And remember, one right of the patient which we didn't mention is you have a right to confidentiality.
Okay.
Means whatever you tell the doctor is confidential. Doctor will not tell.
Cannot tell.
Even if a lady comes to a doctor and whatever the doctor comes to know from that patient, he is not supposed to tell her husband also.
I see.
Without her permission.
Okay.
So your information is confidential. So don't worry. Doctor is not going to tell 10 people कि इसको TB हुआ था.
इसको TB हुआ.
You are right to confidentiality, and therefore be truthful about your past history. About what doctor will say, have you undergone any surgery? So don't hide. So that is your responsibility, and doctor will not be responsible if you don't divulge your proper information. So you have a responsibility of being truthful to the patient. You have a responsibility of doing proper follow-up. Whenever the doctor calls you, 5 दिन बाद आओ, 10 दिन बाद आओ, you
have to go.
Your responsibility. You can't do that. So another important responsibility of the patient is to preserve his records. See, patient would have undergone major surgery, and if you say, please show me the file, he says, वो तो गुम गया. नहीं है, नहीं रखा हमने. So you should preserve the records because it not only helps the doctor, it helps you also. Doctor is able to treat you in a much better manner. So it is your responsibility to see that you preserve your records properly, you carry out instructions properly. Also, I must say, just as the doctor must tell you what will be the cost of treatment, it is also your responsibility. You must also acquaint yourself with what will be the cost. Okay. Whenever you go somewhere, don't you find out what is the cost, can I afford it, can I not afford it? And then you don't blame the doctor later on. Right? So you should also acquaint yourself with the cost. And of course, important responsibility of the patient is to treat the doctor, the staff, the nurses, the paramedical people with due courtesy and respect. See, when you want respect, you should also give respect. And not only that, if you are in a hospital, it also disturbs the other patients as well. if you are abusive
arrogant,
or disrespectful, and of course the physical thing against doctors which are we hear at
okay,
times
yeah.
are also something which are unpardonable, because you have enough grievance redressal mechanisms. You are not supposed to take the law in your own
Yeah,
hand
yeah.
by assaulting a doctor, and it attracts very severe punishments
Mhm.
nowadays. And so these are the responsibilities of patients.
Of the patients. Good. So you have given a reasonable insight about the patient-doctor relationship. We'll have one more session on for medical professionals, because even medical professionals many times are not aware what to do in case of.
Right, right.
So we will have one more podcast on
Certainly,
that.
most certainly.
Because
My pleasure.
okay, thank
Thank
you
you,
very
Mr.
much.
Gadgil.
So thank you very much
Thank
for
you.
coming to Arogyam Katta.
Thank you.
Doctor, I'll ask you a few rapid round fire questions.
Yeah.
Answers of which will be yes, no, or maybe a one-liner.
Right.
So should we start?
Yeah, please.
Okay. Written consent is mandatory for all surgeries.
Yes, it is.
A doctor can be held responsible for a wrong diagnosis.
Yes, provided you can prove that it was due to negligence and not due to an error of judgment, and it has to be proved.
Fine. Patients have the right to see their medical bills in detail.
Certainly.
Recording a conversation with a doctor without their consent is illegal.
Ideally, you should inform the doctor, but you can record.
Hospitals are required to report all deaths to the police.
No.
A patient can change doctor during treatment at a hospital.
Yes, but with proper information to the treating doctor and his consent, which of course would be given.
There is a time limit to file a medical negligence case.
Yes, it is called statute of limitations, and that is 2 years. Within 2 years, the complaint has to be made.
Patients have right to refuse treatment even if it's life-threatening.
No patient can be treated without consent or without permission of the patient, whether it's life-threatening or
A patient cannot be forced to undergo treatment.
yes, patient cannot be forced to undergo treatment.
Is it necessary to get a lawyer for medical negligence case?
No, the patient himself can represent himself at the court.
There is a limit on how much compensation can be claimed for medical negligence.
So whatever compensation anybody claims has to be justified and calculated, and if it is acceptable to the court, there is no limit.
Doctors need to take elaborate written consent from patients before doing any procedure.
Yes, certainly.
How long are medical records preserved by a hospital?
As per the law, they have to preserve for 3 years.
Oh, I thought it was 7 years. No.
No, 3 years is the standard period during which, and of course there are certain exceptions, like for example births and deaths are kept much indefinitely. The children's records are supposed to be kept for 21 years.
Mhm.
The babies,
Okay.
similarly deliveries, etc. But by and large,
3 years
records
is the
are
limit.
preserved for 3 years.
Does a patient have right to refuse treatment?
Patient certainly has a right to refuse treatment. Without his consent, as I said, treatment, no doctor will treat.
Can relatives demand that a patient's ventilator be disconnected?
Normally, no, but now the Supreme Court has come up with a new judgment which allows people to make an advanced will. In advance, the person can make a will like your normal will, saying that if I am unable to communicate, or I am in terminal illness, or if I'm in coma, then I give permission that my ventilator may be discontinued. And so, but unless that is there, the doctors will not disconnect the ventilator, even if the relatives were to say so, if there is no living will, which is now a very recent judgment.
So I was to ask you last question. What is a living will? Is it valid legally?
Yes, a living will is now valid in India. Recently, government has issued guidelines also that in my lifetime I can make a will, like my will for my
Property.
estate, saying that if I am terminally ill and if now the doctors say that there is no point in giving me treatment, then I am giving you permission to please discontinue all
everything.
the life-saving measures. I can also appoint a surrogate, healthcare surrogate who can take decisions on my behalf.
Yeah.
So all that is permissible, but there is a procedure
Procedure for
which is
it.
quite tortuous, though they are trying to make it simple.
Thank you very much for coming on Arogyam Katta.
Thank you.
Thank you.
अगर आपको ये वीडियो पसंद आया हो तो चैनल को सब्सक्राइब करें और लाइक करना ना भूलें। अगर आप किसी विषय पर और जानकारी चाहते हैं तो कमेंट में लिखें ताकि हम आपकी पसंद की वीडियो बना सकें।